I'm Dr. Marla Shapiro, a past president of the North American Menopause Society, and I'm joined today by Dr. Vivian Brown, who's an assistant professor at the University of Toronto. So, you're a primary care practitioner. What's the relationship between women entering midlife, perimenopause, menopause, and does it change her relationship with her primary care doctor?
I think that's a really good question because I think women at midlife suddenly start to pay attention to themselves. They suddenly realize this is a good juncture of time. Things have changed in terms of their cycles, and they often come to their family practitioner who maybe they haven't seen for a couple of years when they've been very busy with younger children and older parents and in that quote-unquote sandwich generation. So I think in midlife, women come back to their family doctor to say, time to look at me. And so it's a wonderful time to reconnect and have that health assessment looking at your long-term risk and the choices you can make at this stage in your life to decrease your risk going onwards.
So for a woman coming in who is in perimenopause or established menopause, what are some of the body systems that you'll speak to them about that they need to be aware of that losing estrogen will have an impact on?
I think the reason they often come in is because they've had a change in their cycle. So women often want to talk about gynecology and often want to talk about what this means. But my agenda is also to include bone health. We know that estrogen has an effect on bone. I want to talk about cardiac health. This is a time when you want to make good changes. I want to talk about cognition and brain health, exercise, and some of the preventions that we know have a great impact, whether someone's smoking, drinking, immunizations, all of the things that when you make good choices may prevent disease ongoing. Because we know lifespan now for women, a third of their life is in the time of menopause. Our great-grandmothers often died in their early 50s. Women are living into their 80s and 90s in North America.
Women often think that menopause is a doorway that you go through, and when their hot flashes and night sweats stop, they're done menopause. But in fact, they're living in menopause. So what are some of the important points, particularly since women are very fearful often about treatment, that you'll discuss with them when it comes to the issue of treatment?
Yeah. So menopause is a transition, it's not a disease. And when I talk to women, I make that point because what I really am talking to them about is their quality of life. And if they're feeling some minor symptoms and they're handling it, they may not need particular medication. On the other hand, if they're disabled by their symptoms, if their symptoms are impairing their quality of life, then we want to talk about what are the options. And the options can be hormonal, which absolutely have a great impact on symptoms, and some women feel so much better. But for some women, that's not a good choice. They may have contraindications or reasons not to take hormones. And we want to talk about non-hormonal therapies that actually have medical evidence. There's lots of talk and buzz about non-hormonal remedies, and I think it's important that women understand what is approved, what has medical evidence, and what is something that may make a difference for them if they need treatment. On the other hand, everybody needs good advice in terms of some options like vitamin D, like a high calcium diet, some of the things that you just want to talk about so that women start to incorporate those healthy lifestyles for the next 30 years.
So for women who sometimes feel, well, I'm done my cycles and I'm basically done my gynecological history and have that sense that they don't need to come in and see their primary care physician, what would you say to them?
I would say that you want to live your best life for the next 30 years, and gynecology is still part of that, whether it's supporting the lining of the vagina, whether it's urinary control, whether it's sexual function. All things evolve with time, and I think when we look at a woman, we're not just looking at one area. In primary care, we're looking at the whole person. This is all about personalized medicine, and what's happening to one person may not be the issues for another person. This is the time to reconnect so you can make the best choices for you, not for your neighbor, not for your sister, the best choices for you.
And a final word about women who think, oh, it's just too late, I've never exercised, I've not really paid attention and whatever.
You know, Marla, I love that question because they did a study of 80-year-old women in a wheelchair, and when they did upper body exercise, their balance was better. They were less likely to fall when they were transferred from the wheelchair to the bed. It's never too late to have an impact. It's never too late to stop smoking. It's never too late to make some of these healthy choices. It's going to have an impact lifelong.
Thank you so much.
Thank you.